What if I told you that one of the world's most famous fairy tales was actually inspired by a real and super rare medical condition? Well, today, let's dive into the absolutely fascinating science behind what people call werewolf syndrome. That's right, Beauty and the Beast wasn't just pulled out of thin air. It was most likely inspired by a real person from the 16th century named Petrus Gonsalves. He had a condition that caused hair to grow all over his body. And this incredible intersection of folklore and medicine is exactly where our story kicks off. So what is this condition really? For centuries, people who had it were completely misunderstood. They were often cruelly put on display in circuses. But today, of course, science helps us move way beyond the myths and get right down to the biology of our hair follicles. Okay, so the official medical term is hypertrichosis. Simply put, it's just excessive hair growth in places you wouldn't normally expect to see it. And here's the most important thing to get right away. It has absolutely nothing to do with the sex hormones that, cause hair growth during puberty. That's a different thing entirely. Now, here's what's so interesting about how this works. You might assume that people with hypertrichosis just have way more hair follicles, right? But that's not it. Instead, the growth phase of their existing follicles, it's called the anagen phase, is basically stuck. It's like a light switch gets flipped on and just won't turn off, which leads to much longer, denser hair. To really get a handle on hypertrichosis, we need to make sure we don't confuse it with another condition called hirsutism. I know, they sound similar and they both involve extra hair, but trust me, their causes are worlds apart. And you can see the key differences right here. Hypertrichosis, like we said, isn't driven by hormones, and it can affect men and women equally. Hirsutism, on the other hand, is caused by an excess of male hormones, androgens, and you see it mostly in women. It causes hair to grow in that classic male pattern, like on the face or chest. So bottom line, different cause, different pattern. So the big question is, where does hypertrichosis come from? Well, it pretty much falls into two main buckets. You can be born with it, or you can develop it later in life. Let's start with the one you're born with. The congenital form is incredibly rare. We're talking only a few hundred cases ever reported in history. It's passed down genetically, and it can either be generalized, meaning hair covers the entire body, or it can be localized, where it's just confined to one specific patch. And here's a really striking example of what that localized version can look like. This is called navoid hypertrichosis, and as you can see, it shows up as this really distinct patch of thick, dense hair. But what if you're not born with it? Well, the acquired form is actually quite a bit more common, and just like the name suggests, it develops later in life, and it's usually triggered by some kind of external factor. And very often, that factor is a medication. Yep, one of the most common triggers is medication. You can see a few drugs here that are known to cause hypertrichosis as a side effect, but I want you to pay special attention to one name you see here, Minoxidil. Does that ring a bell? It totally should, because this is where we get to this amazing, kind of bizarre paradox in medicine. You see, Minoxidil is the active ingredient in Rogaine, which is, one of the most famous hair loss treatments in the entire world. So that raises the million-dollar question, doesn't it? How in the world can the same exact substance be both the problem and the solution? It sounds impossible. But the answer is all in how our bodies actually process the drug. Okay, let's break this down real simple. Minoxidil is what they call a prodrug, which basically means it's inactive when you first take it. Your body has to do the work to turn it on. There's an enzyme called SALT1A1 that converts it into its active form, which is called minoxidil sulfate. That is the molecule that actually tells the hair follicles to get growing. And here's the kicker. Minoxidil was originally developed as a blood pressure medication. This whole hair growth thing was just a weird, unexpected side effect. But it was such a powerful side effect that scientists completely re-engineered the drug's purpose. The problem literally became the solution. How cool is that? Now, whether the hair growth is wanted or unwanted, managing hypertrichosis is about so much more than just how it looks. It involves practical treatments, sure, but just as important is dealing with the really profound psychological impact it can have. The way it's managed really depends on the cause. If a drug is the trigger, well, stopping the drug is the obvious first step. Otherwise, the options range from temporary fixes like shaving and waxing to more permanent solutions like laser hair removal. But look at that last point, the foundation of it all. Psychosocial support. That part is just non-negotiable. It's vital. And this really gets to the heart of why that support is so critical. Living with a visible difference is incredibly tough, especially for kids and teenagers who might have to deal with bullying. And that's exactly why creating a supportive environment at school, with teachers, at home, is considered just as important as any medical treatment they could ever get. The story of minoxidil is just this perfect example of scientific serendipity, where an unwanted side effect accidentally becomes a revolutionary treatment. It really makes you wonder, doesn't it? What other accidental discoveries are just sitting out there waiting to be repurposed into the next big medical breakthrough?